Hello, Chris Grimmett with Omaha Insurance Solutions, speaking to you about the difference between Medicare and Medicaid. The words sound very similar and people quite often confuse them, but they are completely different programs. Medicare is a federally funded program for health insurance for people who are 65 and older, for people that are disabled, that have been disabled for at least 2 years before they're 65, and then for people with end-stage renal disease, that is kidney failure. Medicare is for those individuals, and it's what we call an entitlement. You've paid into it during the course of your working years, and once you reach that age or that particular situation in the case of disability, you are entitled to that health insurance program. Medicaid, on the other hand, is a joint program, joint between the federal government and the state. Funding comes from both, but the administration really is in the hands of each individual state. That program is not an entitlement, but rather for people with low income. How do you get access to Medicaid? Each individual state has its own process. In the case of Nebraska, you simply can Google Access Nebraska or Department of Health and Human Services for Nebraska. Either way, you'll get the phone numbers and address for each individual department and office. Give them a call. How do you know whether you qualify for Medicaid? Well, you simply have to ask. You can go online and there's a process you can go through which determine whether you would qualify for Medicaid in your particular state. Or, again, call them and talk to them over the phone. In my experience, at least in the state of Nebraska, if your income is below $1,000 per month for an individual, you have a very high likelihood of qualifying for Nebraska Medicaid. There's different levels of qualification for Medicaid. The first level is that the state will come in and pay your Part B premium for Medicare, which, as I've said before, is $104.90 per month. To have them cover that cost is a tremendous boost to your budget. The second benefit you can have from Medicaid is that Medicaid can come in and cover the deductibles and coinsurance for Medicare. They may cover everything or part of everything, but in either case, to cover that Part A deductible, which is $1,260, to cover that Part B deductible, $147, to cover the Part B coinsurance of 20% is an incredible savings for someone on a very limited income. Third benefit of Medicaid is it'll come in and help with prescription drugs as well. Now there's a separate plan, a federal plan that helps with that, but each individual state likewise can assist with medications. When someone's on a very limited income, poverty level, even the smallest medication can be overwhelming. Not to mention ones that are more expensive, people who are diabetic, on insulin. There are a lot of medication that can overwhelm a very limited budget, and Medicaid will come in and assist with those prescriptions. The fourth benefit to Medicaid, and again, this is unique to each individual state, but in Nebraska, the two things that I find most helpful for my clients is when Medicaid comes in and covers dental, vision, and transportation. Many times people have difficulty with their teeth, even needing dentures, and Medicaid, if you qualify for that extent, will come in and help with dental and even transportation to the doctor, to the clinics, and help out with that. Again, Medicaid is a needs-based program. The best way to find out whether you qualify and what you qualify for is to contact the local state Medicaid office. Again, I am Chris Grimmett at Omaha Insurance Solutions. If you'd like more information about insurance solutions, especially Medicare, please subscribe to our YouTube channel or go to the website, omahainsurancesolutions.com. Thank you.